I was looking at statistics from the Life Insurance Association of Singapore, and they show that approximately 71% of Singapore residents, or some 2.85 million lives, are protected by integrated shield plans and riders. Now, these provide coverage on top of MediShield Life. In fact, the number of Singaporeans and permanent residents covered by IPs and riders increased by almost 32,000 last year. So, if you have an integrated shield plan, you may want to ask, does my plan fit my needs? Or am I paying for more coverage than I will actually choose to use? Integrated Shield plans give you higher coverage than MediShield Life at a cost. Today, we're going to find out how you can ensure that your IP or Integrated Shield plan works for you. And we'll also go through some questions that you can ask yourself to ensure that you aren't paying for more in terms of, the expected level and type of care that you are likely to eventually use. Raymond Woo is Head of Personal Sales, Raffles Health Insurance. Good morning, Raymond.
Morning, Michelle. Thanks for having me.
Great to have you here this morning, helping us out with this topic. So tell me, what do you know about whether or not Singaporeans tend to be overinsured when it comes to their integrated shield plans?
So Michelle, I guess this is a very much a hot topic recently. So in an online survey back in 2020, Raffles Health Insurance actually did a study to better understand the perception and buying behavior of customers towards an integrated shield plan. And one of the key findings of that survey was that 65% of people who actually own an IP integrated shield plan would consider getting treatment at a lower class ward than what they actually originally signed up for. So what it means is that, for example, if they actually signed up for a coverage at a private hospital, they would actually rather seek treatment in a government restructured hospital instead, typically in a class A ward, or rather maybe even a class B or class C as well. So that's a very interesting finding. And basically, this also kind of validates the previous findings from the Ministry of Health back in 2014, where 60% of people whose plans were actually intended for private hospital coverage and 70% were actually meant for Class A wards, chose to actually stay in a lower class ward entitlement during the hospitalization. So we conclude that these findings actually highlight the importance of the need to review our integrated shield plans regularly and hence choose a plan that is most suitable for ourselves and our loved ones. And basically, we hope that through this interview series, we can actually help our listeners, enable our listeners to make a better informed decision about their integrated shield plans.
Yeah, great stats there. So some 65%, and if you're listening and you could be among the 65% of people who think that they are paying rather for private healthcare, but then when it comes down to it, are choosing a restructured hospital and so not private healthcare. Walk us through and break down for us what being overinsured really means for listeners' wallets.
Okay, so when it comes to being overinsured, what exactly do we mean by it? So in very simple terms, being overinsured means that basically you're having more insurance coverage than what you actually would require. So the question would be, how much exactly is too much, right? I mean, ultimately, if I buy an insurance plan, I want to make sure that everything is taken care of. When something happens to me, I do not want to have to actually worry at all. But having said that, there is a cost to insurance, and that's basically through the premiums that you pay. So again, looking back at our survey, right, for what we receive in terms of the results from the respondents, up to about 41% of them would actually prefer seeking treatment at a lower class ward. And the concern that they raised actually is that they actually wanted to pay lesser co-payment and deductibles. So the co-payments and deductibles are basically parts of your integrated shield plan, which are actually borne by you, basically your out-of-pocket expenses. And of course, the rest of the residual bill will actually be covered by the shield plan. So one of the reasons why these respondents actually decided to kind of seek treatment at a lower ward is because they didn't want to pay so much out of pocket. So, yeah.
So then reality hits when they actually have to use or exercise the integrated shield plans, and then they realize the co-payment components. So there are two components, right? Co-payment and the other one you mentioned?
There's a deductible. So the
The
deductible
deductible.
is, yeah, the deductible is kind of like your car insurance excess. So basically, it's the first X amount of dollars that you have to pay before you can actually seek to get reimbursements from your integrated shield plan.
Okay. So are there any other issues that the overinsured might find themselves running into?
Well, one other issue that we've actually identified is that some of the respondents actually mentioned that they would also like to factor in the future outpatient visits. Basically, these are the costs of consultations, follow-up, after they've been discharged. Because we know that sometimes, being hospitalized for your condition is one thing, but thereafter
Mm.
there's a fair bit of follow-up consultations, subsequent treatments and everything. And of course, these costs would also stack up. So it does really make sense to actually factor all these future outpatient visits as part of the overall bill. And that's also the reason why, that's also one of the considerations as to why they actually would like to seek a lower class ward than what they actually were entitled to.
You're listening to Your Health, Your Wealth. Raymond Woo is head of personal sales, Raffles Health Insurance, joining us today as we ask how much is enough? Key questions to ask when considering an integrated shield plan. Welcome back to Your Health, Your Wealth. Raymond Woo is head of personal sales at Raffles Health Insurance. And today we're trying to figure out what questions you need to ask yourself when considering an integrated shield plan. And if you don't want to pay for more premiums for a plan that you might choose not to exercise fully, because you may choose a lower ward than what your IP plan allows for. Raymond, what are some key considerations you think people should be listing out when thinking about finding an IP for themselves?
Well, some of the key considerations will, of course, be the kind of coverage that you actually are seeking. Like some of us would prefer the comforts of a private ward, private hospital, they may deem that the facilities are much better. And of course, the other consideration will also be in terms of the personal budget, because everyone's personal finances, financial stages may actually be quite different. And when it comes to insurance, especially, hospitalization, cost care insurance, it is a very long-term commitment. You're literally paying for it for the rest of your life. And the thing about hospitalization plans is that premiums tend to actually be more expensive as we get older. So that is a very, very key and important consideration as to whether or not when you're selecting a plan, it is sustainable for the long term.
All right. So, why should anyone look beyond this one consideration when choosing an IP, and that is whether or not they can make that premium payment?
All right. So one of the main considerations is that ultimately, when it comes to the longer term affordability of the plan, you might want to ensure that you can continue paying for the plan, and at the same time, do not compromise on your coverage. I think it's important that you do not actually shortchange yourself in coverage,
Mm.
especially as the older we get, as we age. There is a higher probability that we actually would need to seek medical and hospitalization treatment. So there's always a lot of talk about overinsurance, like for example, when I'm young, when the premiums are much more affordable, I would think that, yes, I want the best in everything, right? I
Yep.
can afford it. But the
Hmm.
thing is that sometimes when it comes to overinsurance, are we actually overindulging? Are we actually overdoing it? It's like saying, if you go to a restaurant for buffet, right? And if you've got a very, very small appetite, you can't really eat much. Does it make sense for you to actually indulge in a buffet spread when you actually only can, gobble down maybe one or two courses? So that's the kind of analogy that we like to actually share with your clients. So it doesn't mean that you want to have to go for the best plan out there. What we actually
Mm.
advise clients is that you should go for what is suitable for you, and you have to factor in the longer term needs. So that is part of the advisory process that we dish out to our clients.
Choose the buffet spread that works for you when it comes to healthcare and your integrated shield plans. Love that, Raymond.
Thank
Earlier
you.
on, you made a really powerful point, and for listeners who have just joined us this morning on Your Health, Your Wealth, I don't want them to miss out on that. We are talking about this whole idea of overinsurance. So, Raymond, remind us again why. Although some insurance offers higher type ward A, B1 coverage in private hospitals, your surveys have uncovered that people choose sometimes a lower ward than what their IP allows for. Can you share those reasons for us again and the mindset behind that choice?
Sure, Michelle. So for those of you who just joined us, welcome. So I was actually sharing earlier on that one consideration or as to why actually patients actually decide to go for a lower ward entitlement than what they can actually go for is the
Mm.
cost, right? I mean, they feel that ultimately I do not want to spend so much on my co-insurance and deductible. So the co-insurance and deductible are two aspects of a plan which are actually out-of-pocket expenses
And do
borne
you
by
have to
the
pay for that
customer.
with cash? Co-payment and
Yes,
deductibles have to be
yes.
paid for in cash.
There's a
Got it.
possibility of that, correct. And of course, ultimately, it doesn't stop at there. It doesn't just stop at the admissions. Upon discharge, more often than not, we do actually have to go for follow-up treatments, follow-up consultations, and all this would actually be factored into the costing as well.
And the
So
price and the limits that you can claim for your outpatient treatment depend on the type of plan that you've picked or the type of ward that you've chosen.
it also depends on the ward and the plan as
Mm.
well. Mm. And of course, if we do dive deeper, I mean, the kind of subsidies which the government actually gives to Singaporeans as well as PRs also varies based on the ward type that is actually chosen. So all these are very major considerations, and that's why we feel that although so much information is available online right now, I mean, people are at liberty to choose and have access to all the information on all the plans out there. It is always good to speak to an advisor, right? Because these are the professionals who would be able to analyze your needs, not just for the
Mhm.
immediate future, but for the long term as well, and of course recommend a suitable plan based on your needs that would be sustainable and very effective towards your longer term hospitalization cost protection needs.
And listeners, he's our advisor today, Raymond Woo, Head of Personal Sales, Raffles Health Insurance, joining us this morning for this warm chat. Now, Raymond, we're going to dedicate a show to riders, but for listeners who may be making a decision right after they hear this show, going online to buy an integrated shield plan, what do they need to understand about how riders can impact affordability and why they should look beyond, again, whether they can afford the premium of a rider?
Okay. I'm glad you asked this question, Michelle. In fact, our next speaker in next week's interview will actually be sharing a bit more on this particular topic. But since we are on this today, do let me share a little bit about it as well. So the thing about riders is that they literally follow the main plan. So if let's say you're covered with a private kind of plan, the rider will also be based on the private base plan. So that would also mean that the premiums would also be very much aligned towards the other base plan. So if you are going for a private plan, it will also mean that your rider's premiums would be correspondingly higher. So what it means is that unlike the base plan, whereby you are actually allowed to pay for it using your MediSave, subject to the withdrawal limits, riders are totally payable in cash. Okay, and we all know that for integrated shield plans premiums, the premiums will actually increase through the different age bandings attained. So meaning to say
Yep.
that it gets more expensive as we age. So the riders especially can actually take an economic toll in the later years if you're not prepared for it. So that is one consideration that you want to make sure that the riders that you choose correspond with the right plan so that you do not actually have to make a painful decision to downgrade your plan in the future.
Great points there. Next time, is there an integrated shield plan that will allow you access to private hospital care more affordably than you may have expected? Is there a product that will give you access to restructured and a private hospital that balances the desire for both private hospital care and, of course, affordability? We're going to find out next Friday at 10:05 a.m. right here on Money and Me. I'm Michelle Martin, today joined by Raymond Woo, Head of Personal Sales, Raffles Health Insurance. Raymond, thank you for being with us.
Thank you, Michelle.
Money FM 89.3.